Let's start things off by being very real. Working in healthcare isn't easy. Whether you are a doctor, a nurse, a technician, billing agent, cook, or environmental services worker, you play a critical role in the care and overall health of every patient that walks through our doors. It's important to understand that every patient interaction matters, whether you are directly involved with patient care or not. The purpose of this video is to illustrate why it is so important to fully listen so that you and the patient are on the same page. Every hospital in the U.S. is required to survey their inpatients about two key questions. How well did we listen? And how well did we explain? Statistics show that a majority of complaints and lawsuits are a result of providers not fully listening when they first encounter a patient and not fully explaining to patients what is wrong with them and what they are supposed to do to get better. The more time we take to listen up front and then explain in a way the patient understands, the more successful the healthcare encounter will be for both the physical and emotional well-being of our patients. Our own HCAHPS numbers tell the story. 85% of Tahoe Forest patients have said providers and staff explained things in a way they understood. 90% have said providers and staff fully listened and understood them. While our numbers are good, there is room for improvement. Imagine this scenario. A patient comes to the emergency room for stomach pain. The nurse practitioner starts to ask about symptoms, but appears to be in a bit of a hurry. She is listening to the patient, but as he's explaining his symptoms, she begins to examine him and quickly orders some tests. The patient is confused, but he agrees to the tests. When the NP comes back, she tells the patient his tests are all negative. The patient, who is still suffering from stomach pain, mentions to the NP that he had recently traveled outside of the US and drank water from a river. She asks him, "Why didn't you say that at first?" The patient is now not only still in pain, but also feels embarrassed and a bit humiliated. The NP orders new tests, gets the results, and treats the patient. By not fully listening to the patient from the very beginning, the NP created additional costs for tests the patient didn't need, lengthened the time the patient spent in the ER, and left him with a negative impression of his interaction at Tahoe Forest Hospital. Now consider this scenario. A patient goes to the doctor complaining of chest pain, shortness of breath, and overall discomfort. She is admitted to the ICU for observation and tests to see if she is having a heart attack. They do blood work, electrocardiograms, and they watch over her for 2 days. At the end of 2 days, her doctor returns to tell her she's fine. She didn't have a heart attack. Confused, the patient asks the doctor what could have caused her symptoms. He tells her he's not really sure, but he is sure it wasn't her heart. If the doctor would have fully listened to the patient when he took her initial history, he would have learned that her husband of 30 years had committed suicide exactly 1 year ago to the day that her chest pain, shortness of breath, and discomfort began. A complete care plan would have included asking questions about things in the patient's life that could be causing stress, anxiety, or other physical symptoms. Rather than an invasive and costly ICU stay, the patient could have been referred to mental health and support specialists who could help her cope with unresolved grief that likely caused her anxiety and physical symptoms. The mistakes made in these two examples may be obvious and a bit oversimplified, but try to remember there are so many little details that really matter when you're interacting with a patient. Are you sitting at the same level as the patient? Are you making eye contact and really focusing on what they're saying? Did you introduce yourself to everyone in the room? Are you fully listening? And are you fully explaining so they can understand? Our challenge for you is to think of just one thing you can do to improve your interactions with patients. Try it out, see how it feels, and see the reaction you get.